We are live, you can begin.
Very good evening, everyone, and once again, welcome all of our viewers for yet another very interesting session at GAPSULE initiated by Doc Mode. As we all know, GAPSULE is a first of an industry dialogue series aimed at bridging the knowledge gap between the healthcare industry and medical practitioners for better patient outcomes. Today's discussion is quite interesting. Why? Because what we are trying to discuss is the current situation in pharmaceutical sector and a little bit of touch base how other industries are also influencing it, be it like a digital environment, and how what is the success rate, what are the challenges in the omni channel marketing which is trying to be adjusted in the normal market scenario, what are the innovative approach which generally required in traditional marketing settings, what's happening into that segment, what are the content strategies to lure the HCPs are shaping up, what are the challenges how pharmaceutical sector is facing while going back after the post covid, be it like a price control issues, regulatory issues, maybe there are a lot of hospital movement restrictions, new research pipeline is getting dried, so multiple facet of challenges and how we have to drive that. There are a lot of insights which have been taken out of it, and every single pharma company is trying to drive the thing. There might be a lot of macroeconomic influence, how the new pharmaceutical new budget is going to change the pharmaceutical industry. And to discuss this all, we have a very eminent subject matter experts today with us. And first of all, I would like to welcome our eminent panelists today. Our first panelist is none other than Dr. P.K. Rajput. I sincerely welcome Dr. P.K. Rajput, sir, and for this important session on discussion. Dr. P.K. Rajput, sir, is basically a former senior vice president at domestic and international business, Ketla Pharmaceuticals. He has been having a rich experience of 40 years plus in pharmaceutical and healthcare industry in sales and marketing. Dr. Rajput has successfully handled domestic business and also international and multinational based at Ahmedabad. He is an advisory board member of more than 26 universities and institutions across nations. He has been awarded as a Man of Excellence Award in 2020, Business Leadership 2021, and Atmanirbhar Award 21 by Indian Achiever for You. He is a global speaker of Global Mental Health Association USA and Global Youth Mental Health Awareness Australia. I want to sincerely welcome Dr. P.K. Rajput sir for today's discussion. Our another very important panelist today with us is one of my good friend, Mr. Manas Ranjan Rao. He comes from an industry which is basically works on the insights, and insight is the first key point to drive your strategy, to drive your go to market plans. Manas has been into this industry since quite long and has delivered some good key success formulas for different companies. Manas is currently Vice President of Strategic Analysis of Asia. He was Asia Pac, Africa, Middle East, and was a team leader for project delivery in different in IT industry, telecommunications, automotive. He was a country manager for Torrent Pharmaceuticals, and currently he is working as a faculty. He was also working as a faculty member in MIT University Noida for post graduation programs. I sincerely welcome Manas for such an important discussion today. Our third and very important, in a very interesting personality with us, Mr. Manveer S. Mali, a marketing consultant and have been an award winning marketing professional, having strategized and devised radical stratagems that have not only helped 100 plus iconic brands, but revolutionized their marketing presence by adopting new media to drive strong and trackable business results. In past, he scaled social samosa. I still remember social samosa, the blogspot. It's very popular as a part of founding team before it got acquired by a private set of investors. Sincerely welcome Mr. Manveer for this important session. And now, the most important part is all three subject matter experts provides a different insight to us. We have a different set of questions which will help us to identify and ensure that viewers will get best out of it to make sure that they will apply the same thing in their day-to-day working lifestyle. So, first of all, one of the most important question today I would like to initiate from Dr. Rajput sir. What do you think the overall environment looks like for the pharma and healthcare industry in 2023?
So, very, very good afternoon, and to you, Mr. Odit, for a nice introduction
Thank
along with
you.
my co-panelist. And I'm very happy to be a part of GAPSULE because this is one of the very wonderful platform which keep on guiding, teaching, making the people understand about the industry, and you always add a lot of the beauty and arena in the things. So the question is fabulous, let me tell you, because that is very important. And I like to say the overall environment is a remarkable perception shift is there, which is going being a volume manufacturer to the value creator. Right. So we have to have the value creation because India, is the ranked the third worldwide for production by the volume, which is accounting by 20% of the global volume supply. Second thing is which is coming up apart from this, because since we are talking about the marketing in digitalization world, not the digitalized marketing. So there is a change is going to happen. The second thing which is going to be there, that diagnostic is going to play a major role, because you know that 70% of the things are coming up through the diagnostic part, which is really going to make a huge difference. Another point is coming up with the hospital and the pharmacies, because the strong growth dynamics for the hospital is coming up due to the severe under penetration, especially not only in the tier 1 but in the tier 2 cities, and gradually it is expanding. Medical tourism is a strong opportunity for the hospitals, and market is expected to rise by 65% CAGR during this 4 to 5 years of the time. So I always say that it is a great opportunity where the pharmaceutical is booming. And when you talk anybody about a pharma today, when say I was in the meeting, they said, "Oh my God, pharma is booming like anything. There are a lot of changes are coming, new molecules are coming up, and we are already known as the pharmacy of the world. And as per our respected Prime Minister, by 2030, we will be the leaders in all the ways. We are going to beat China, which is very important. So I can see a complete bright future in any way and every way, which I'm able to foresee it with what I have learned from the people like you, what I've learned from the other people who are marketing it, who are selling it, who are manufacturing it. This is all about it from my side.
Absolutely bang on start by Dr. Rajput sir. Actually, the market is expanding like anything in all segments. Idea is to give the right pathway, right streamlining, so that there is a proper constructive growth is going on. And I would like to listen the same context from the different scenario from Manas. How do you see this overall 2023 for the pharma and healthcare industry?
Thank you so much, Udit, and the entire Capsule team for the invitation. Great to share the dice with Dr. Rajput sir. My sincere gratitude, sir. Thank you so much for it's a long time that we have spoken over phone only. Uh, 2023 scenario is actually very fabulous. I will start with that from the pharmacy of the world. India is heading towards life science and technology of the world. That is the first thing that we have to
Right.
understand. Second thing, COVID has set the stage for us. COVID has fantastically set the stage for us. I'll start in my webinars. I always take the example of Red SC, revolution, evolution, digitalization, startups, and consolidation. These are the five parameters which has set the entire stage for our country, domestically and internationally. So let me start with API. If you remember when COVID hit the market, the first thing government of India did, 93% of our API is coming out of China. The first thing, they have declared $1 billion amount to set up the API hubs the entire country. Over the next 5 years, just count on the entire country. The next 5 years, the dynamics of API is going to completely change, and it is actually started with 2022. Number two, R&D, which was everybody was talking about that India is a sleeping R&D. Ladies and gentlemen, let me tell you, you cannot believe it. COVID vaccines, 14 institutions. Due to sort of time, I will not name every company. 14 institutions and companies came up with COVID vaccination. Can you imagine? Covaxin. Covaxin is the product which got into the market. We got Zydus one product which is coming to the market. Third thing, a new segment got created in COVID and it has been expanded big time, which is called sterilized industry. We became number one or number two in PPI kit. We became number one, number two in mask. We became number one and number two in sanitizer. Enter world. I'm talking about enter world. We not just left out with this. When we talk about R&D, innovation and technology, nanoparticle products get into the market. एक बार स्प्रे करो 6 महीना you are sterilized. Can you imagine India has given this gift to the entire world? Last हम बोलते हैं कि हम हॉस्पिटल में जाके कोविड की टेस्ट करेंगे. कोविड सेल्फ एक किट आया घर में 300 रुपए में घर में बैठ के टेस्ट करेंगे which is fantastically with कोविड. I'll just go back to COVID. इसमें कुछ बोलने का नहीं है. In the entire world, the world's largest vaccination happened in India. Thanks to the technology partners who has been collaborated with the government of India. Overnight, the dynamics got changed. Day before yesterday, Prime Minister of our country, Honorable Modi Sahab, has declared 220.16 crore doses has been implemented.
Correct.
This is new generation India. We are standing on 2023. Number 4, to talk about 2023 is the mega channel distribution. Channel partners ka dynamic. There are few companies who are going to lead the segment like Entero, like not only acquiring the biggest distributor, but also streamlining the distribution management. I expect as a business analyst over next 5 years, the mega channels are going to lead the domestic market of our country with left out with only 3 or 4 companies.
Absolutely.
Number 4, the biggest thing which happened in the entire world, but India is leading, it is called telemedicine.
Yes.
I don't know how many of you knows today in India, that to be government of India, we got the biggest telemedicine platform with us called E-Sanjeevani OPD. The website and see the momentum of the OPDs. You're shocked to see this, which actually drive companies like which is world's largest telemedicine platform to come to India.
Absolutely.
This is happening in India. Then talking about internet users, सर कौन नहीं आया इंडिया में? कौन नहीं आया? भी आया, एप्पल भी आया, IBM भी आया, माइक्रोसॉफ्ट भी आया. Only due to one reason that as a country we 8 to 5 million internet users, 1.2 billion mobile users. हेल्थ आ गया सर, हाथ में हेल्थ केयर आ गया. No need to visit the hospital today. The new dynamics is telemedicine. The biggest thing happened and which is going to actually drive from 2023 towards 2027 is the digital health of government of India. Shocking. You see, sir, AWA, which has been launched few months before for the digital health. Just see the statistics, though it's going. Ayushman Bharat, world's largest social cause, has been happened by India.
Yes.
And
I totally agree.
एट होम सर, अब देखो सर, हेल्थ केयर होम में कोविड से पहले चार कंपनियां 5 कंपनियां थे. नाइटिंगेल, प्रैक्टो, पोटिया लाइक कंपनीज. यू hospital which has not today the offering of healthcare at home. So these as Rajput sir also mentioned, diagnosis, बात करेंगे तो 1 घंटा भी कम पड़ेगा. Lot of diagnosis things are happening. I'll tell you one statistics which is going to surprise the viewers. I'm sure many people must be knowing it. Health tech startup, 34 categories, 2,500 entrepreneurs got space. Within last 2 years post COVID, 34 category or 2500 innovative companies. Yesterday I was speaking to somebody, one of my very close senior. He told that my daughter has developed one watch which can diagnose heart attack 1 hour before and sensitize the nearest hospital. This is the technology, and surprised to know that Google has invested with her daughter. He's the next generation guys are coming with. And आर्टिफिशियल इंटेलिजेंस, हम क्या बात करेंगे आर्टिफिशियल इंटेलिजेंस में, क्या नहीं हो रहा है, और इंडिया आर कंट्रीज बिकमिंग हब. सो इन द नटसेल, 2023 is going to be a year of surprises, collaborations, multinationals feeling some hit due to new regulatories which is coming in place in terms of promotion, marketing strategies. As a result, multinational has collaborating with large Indian companies like Dr. Reddy, Cipla, Lupin. There are a lot of collaboration happening, and that thing
Yeah.
is going lead the segment in 2023. Last, not the least, the entire pharma community, entire healthcare community, diagnostics, medical equipment, hospitals, pharmaceuticals, everybody is currently working on patient centricity. So you can imagine now 2023 is actually started with a very good note. As I said earlier, that COVID has already set the stage. We as a country, as a company, need to lead the entire pharma community. That is from my side.
Thanks, Manas. I think fantastically summarized the overall pharma industry in just 5 to 10 minutes, and what is happening also in very encouraging manner. But I would like to ask Manveer the other side of the story of digital part, because we talk too much about the digital aspects, but there are some dark stories and dark sides of it where we see that though we have launched too many of things, but the success rate is something which we have to work upon, and what are the key challenges and how we have to identify which is the right, what went well and what went right. So Manveer also have some kind of pharmaceutical touch base also, and we would like to listen from the other sectors how you are trying to create the right perspective onto it.
Yeah. Thanks, Udit, for having me on the panel. And wonderful point shared by Dr. Rajput and Mr. Manas. Taking the conversation, forward from what points Mr. Manas shared. I think there gonna be some amazing transformation in healthcare industry in coming years, especially from a point of view of remote healthcare to data science to wearable technologies, like the example shared by Manas. Google investing in
Yeah.
that company. Uh, to come into the dark side, let me come into the first question which you asked. I think the major issue which I see specifically from a technology perspective, right, from a digital perspective, is of data science. Like, there's too much of information out there, too much of content, too much of prediction, monitoring, detailing which is required. Uh, I think that issue will somehow get sorted, and the primary reason for that
Mm,
is the use of data science. And by data science, I
mm,
mean a lot of pharmaceutical companies, a lot of healthcare startups will come up with the usefulness of AI. They will integrate machine learning, and this trend will grow further, and this will declutter the data-driven decision-making processes. It will reduce the cost. It will help in compliance. It will help to read the data of patients in a more effective manner, right?
yes.
So that is
Yes.
the majority of the issues. I think the AI, we all know, or from past 2 3 months, uh, over internet, everyone is talking about Chat GPT, right?
Correct.
So that way, I think in coming few months, it will get revolutionized by the use of artificial intelligence
Mm,
and data science, and it will actually improve the overall effectiveness, right from healthcare to even for remote healthcare of patients. So that is one area which I think is something which was neglected, because there is too much of overflow of data. But how do you analyze that data from various sources? And so AI is something which will revolutionize that, and healthcare professional will be able to identify trends. They will be able to identify patterns, and thus they will be able to make better decisions in the patient journey, right? Uh, Coming to what are the trends which will happen, right? Like, which are the trends which I see happening in healthcare industry, especially from a digital
mhm.
perspective. I think a remote healthcare,
Yes.
as
Yes.
discussed by and also told by Manas, I think that will take a hugely. Right before COVID, it was almost impossible for people in the remote area to request for a video consultation from a general practitioner.
Right.
But that has completely changed now with everyone having access to smartphone, you know, and the cost, right? Because of all the policies which the government has launched, the cost of delivering face-to-face healthcare is continuously, going down, and
Mm-hmm.
people are able to access remote healthcare solution, like as telemedicine. Then you have patient
Correct.
monitoring.
Correct.
Then with the adoption of tracking being adopted, right? That is something which you will see a lot of people becoming accessing technology and taking remote healthcare as a solution. Then I think consumerization of healthcare will happen, because
I
content plays a major role, right? And I'm seeing a lot of doctors, a lot of pharma people have become content creators on digital or social media platforms. Okay, there are people who are creating now, churning content. So consumer are more aware right now, right? How they can actually communicate or interact with healthcare professionals or doctors, right? So healthcare companies also need to pay close attention, like what consumers are expecting, understand the
Mm-hmm.
data science, what kind of content is being
Yes.
consumed by consumers on online space. I think that adds to the overall omni-channel experience. So this also helps, the kind of content consumption users are consuming, and then probably create IP based product around that. Like wonderful example was shared, like how we created an OTT. There's an OTT which was created for doctors, right? Uh,
Correct.
so Mr. Manas,
Yes.
discuss about that. So I think you will see a lot of this digital IPs being created for doctors, for pharma professionals, for even hospitals will come up with that, and especially the end goal is to meet the consumer in the end. So that is one trend which I see, uh, and the primary change which you will see, and that is because of the startups which are growing into the space and adopting digital technologies. Uh, I think you will see a lot of personalized medicines through digital,
Correct.
technology,
Digital
like
therapeutics is something is getting involved
yeah,
now.
yeah. So you will see a lot of startups with boosted cloud technologies like augmented reality, virtual reality, using artificial intelligence. They will come up with personalized medicine for a specific set of patients. Uh, so patient engagement will take a seat, uh, for the seat, and then self efficacy to improve the overall patient journey, which will lead to better outcomes. Uh,
Hmm.
so healthcare stakeholders, I think, will focus a lot on personalized medicine, and digital technologies is something which will
Hmm.
enable them to speed up this complete process. And I think this decade belonged to India in terms of healthcare revolution. I think then we do not beat all the countries in terms of healthcare infrastructure, in terms of
Hmm.
the technology we are using for healthcare, and digitalization of every part of that journey, right from creating those technologies to monitoring to creating those devices, then post monitoring, everything would be digitalized. And I think next few years would be great for overall pharma and medical industry, be it life science or be it like medicines or telemedicines. So
Yeah.
look forward to coming years.
Wonderful, Manveer. I think Manas would like to point something. Yes, Manas.
Sure.
I was part of 5G Mobile Congress
Uh-huh.
when 5G launched into the market.
Right.
You'll surprised to know the entire, when you listen 5G Mobile Congress, everybody will thought that something is being happened in the mobile space by Airtel or Jio or Vodafone or Idea. You're surprised to know when I got into that space, that entire Pragati Maidan was full of multiple things. But when we got entered into 5G Mobile Congress, I got Tata Communication dies.
Mm-hmm.
According to Manvinder Singh sirs and Rajput sir think that telemedicine, you'll surprise Tata has built up a platform जिसमें टेलीमेडिसिन होएगा, 5G टेस्ट होएगा 5 मिनट में. रिपोर्ट 5 मिनट में जनरेट होगा, और इंटरेस्टिंगली उसमें एक सिम लगेगा, कोई मोबाइल इंटरनेट कनेक्शन नहीं लगेगा. So the technology is saying na, India is definitely going to lead that segment. आप देखिए सर जाके वेबसाइट में एयरटेल, जियो हेल्थ तो बिग टाइम सर, मैं कुछ उसमें कुछ बोलने का है नहीं. दे गॉट इन्वेस्टमेंट, दे बिफोर कोविड दे brought a company called Now Floats. Today Now Floats got more than 1 lakh doctor in their platform for telemedicine. So
Right.
is going to definitely take. And sir, SBI, ICICI, SDFC, Kotak Mahindra, जिन जो हॉस्पिटल खोलने के लिए लोन देते थे, बोलते हैं अभी हम लोग शेयर होल्डर बनेंगे हॉस्पिटल में. सो investment is going side by side. The best part of our country is the new generation X people are coming with the innovation. Specifically, salute to the IT people who are actually started enabling. They are the enabler of pharma and healthcare industry. Sorry to interrupt, sir.
No worries. I think very important pertaining answers what we have received in terms of digital aspects, what's happening overall in the market. But next question is something which is very interesting and in curiosity point of view for all the pharma marketers and sales representatives in the current countries, their balance to understand the digital perspective and the traditional marketing strategies. Why? Because after the COVID, still there are a lot of companies who are emphasizing a lot about digital marketing, but seeing the growth perspective, the overall ideation, the vision of the company, the digital perspective is not giving as much as that result what was expected out of it. So, Dr. Rajput, sir, you have been a part of this industry almost 40 years. You know the DNA of a sales colleague who is going absolutely around whole day meeting a doctor, and this whole scenario of digitalization, what has happened last 2 years, their adoption, and then their way of doing the traditional sales orientation through the marketing strategy, what their corporate made for them. How do you see a balance of it, or is there any pressure so that everybody is trying to create a responsibility कि मेरे को करना ही है? It's like that. So where is this nudge?
Another an excellent, brilliant question, right? So very happy with the reply of Mr. Manas and Mr. Manveer about it. But now when we talk about the digitalization, people they talk about the digital marketing, but I say it is a marketing in the digital era. I repeat, marketing in the digital era, which has to be
Yes.
taken and which has to be conceptualized. So now when I see there is people they are talking like everybody is there, yes, we have to do it. But what has to be done? It should come from top to bottom. Then there
Correct.
the bottom is again tier one, tier two, and tier three. So the people who are there, the footholders, they are not able to accept the thing which is really required. And the people who are on the
Yes.
second level, third level, they are not being channelized. What we talk about it, right? Which is very, very important. So when we talk about there are 4 5 things challenges are there which I like to have, which I like to talk here. One is the skill shortages. So when see how much we are spending on the L&D part to ensure to upgrade and upskill the knowledge of the people. See the senior people on like me or the with so much experience, how much willingness I'm ready to spend my time to understand about the digitalization, very frankly speaking. And if I'm able to understand how I'm able to
Right.
percolate down the level and how when the area manager or regional manager is taking their meetings, how they are talking about it. Because again, we have to segmentize the doctors in 3 segments. One is the doctor which is on the niche market, niche products, like on the Apollo hospital, big hospital, they know about the thing which are because they like to take over and they like to change over the patient introduction to the VR part because they want to tell that how the virtual reality is going to help to the patient, how a medicine is going to help. So they understand about it. With the two-tier type of the doctors are there. They want to be digitally strong, but still nobody is there to help them. So they want that physical part should be there, and at the same time, some new thing is coming up. A small video or some KOL is talking about the KBL, right? Is talking about something that now we are talking about the key digital leader, right? So not KOL, not KBL. So person who is more about it, KDL, he is talking and he is giving some insight. And the third part is the people who are in the small area because they don't know anything. They only know heart to heart selling. right? So you have to come about it, you have to talk about it. So this is there. So there is a difference. The skill shortage is very important. Second chain is that the cultural focus has to be taken care, because if we want to adopt it, it has to be adopted to the person who is working down in the market, and it in the most simplest way. Suppose everybody today, sir, everybody is taking this iPad. But what the iPad with they are doing it? Just flipping the iPad? No. There has to be a product demonstration. So person should understand that how the product is working. Like I want to give an example of inhaler, right? So today the Cipla was earlier that if Cipla was giving inhaler, people have to suck like that. But now the new technology has come. The Roche has developed a new technology which you simply take the inhaler and you can see how it is going in the lungs. So this is the way we have to tell the doctors. Second thing is we have to have the change in the language processing part. Today we talk about the NLP. So natural language processing is very important. A person from Golconda, a person from Khammam goes to the north area. He doesn't understand. People want to make him understand, right? But how the cancer is going to be cured? It has to be with the digitization. The VR is going to help. So this is a paradigm shift is very important, which company, if they are adopting it, they should adopt it completely. They should not be in the doldrums, because everybody wants to be a part of it. And it is very important to make them understand and learn. So this is all from which I can say people are inclined to it, but people have to spend their time to learn on this. Then only things is going to happen.
Yes, I think the most important thing is any kind of transformation is all about how you make life simpler for anybody, any stakeholder, be it's like HCPs or the person who is going to transfer your communication, the sales team, the Salesforce team. Ideation
Because
is
see that today we are talking about today. I just want to add one thing with your due permission. Today we are talking about the
sure, sir.
omni-channel marketing. What Mr. Singh has said about it. So omni-channel is like you should be available in all the places. It is not that detailing is the one thing. You should have the virtual reality, augmented reality, personalized medicine, which we just now spoke to her, social media marketing, which is a set of the people are there who are inclined to the
Right.
social media. People are there to the Facebook, to the Twitter, right? Mobile health apps are there because mobile health apps are taking care for the things. Right, communication is going to happen. Telemedicine, which Mr. Manas has taken it very well. So these are the things are there which has the different buckets which has to be adopted, which is really required, and it is the need of the hour. Because if we want to see, we want to have that spurt, if we want to take that accelerated train, we have to know the gears of it, we know the speed, which is very important.
Yeah, we need to strengthen them because we should not open certain but all the Pandora box with all kind of amenities. For strengthen the main basic areas first, so that I should know or the top person should know, am I going on the right way, or am I on the right speed, or am I investing good amount of investment in that direction that 5 year down the line this will help me, because any such kind of transformation change need at least 5 year story. So these are the small perspective every I'm sure that all pharmaceutical companies doing it. Manveer, I just want to have a one very pertinent question. We talked about a lot of digitization actually in the current discussion. What's very important is any some so in the last part you talked about the digital therapeutic section where even Manas told the new a device which will tell you exactly 1 hour before that you might get the heart attack. But what are the other emerging trends you believe which is important in terms of digital environment for the engagements of HCP perspective?
Yeah. So I think there are two key things which I see, right? One is, of course, use of augmented reality, which I will discuss after I discuss the second pointer, which because I want to spend some time on that. The emergence of metaverse, actually, right? Uh, so very few, you know, healthcare technology companies or pharma companies have actually, gone into that space. But just to put that into a simple perspective, like everyone knows about Mohalla Clinic of Arvind Kejriwal, right? Similarly, in near future, you will actually see virtual clinic. Okay, but what do I mean by virtual clinic? So right in of your mobile handset or your iPad, you can actually log in, and in metaverse, you can actually visit a doctor clinic, right? So that kind of technologies are happening across the globe. A lot of nations, who are developed are using those technologies. See, one challenge at India, right? What we need to also understand is that we are a nation with scale, right? So to implement any technology, it needs to be implemented at a scale, right? If we implement it in bits and pieces, it won't work. So that's how the adaptation also technology has happened very quickly, right? And from 1,000 to 1, so from 0 to 1 it takes time, from 1 to 10 and 10 to 100, it speeds up. So I think the base level work has been done, but now you will see a lot of innovations, technologies are taking, front seat. So I think metaverse is something which will change the complete dimension of how we look at uh, connecting with patients, or reaching out to remote patients for any healthcare needs. uh, Secondly, innovations in terms of AR VR. uh, so I know of this company name, actually Simulation. I'm working with them as a marketing consultant. So these people provide training to a lot of healthcare professionals, be it doctors, in terms of performing the surgery. So you can actually wear those headsets, eyewears,
Mhm.
and you can perform surgery in simulation, right? So it's
Okay.
actually similar to surgery you are performing in real life, and it gives you that experience. So what it does is it get better trained doctors in the market, right? In their when they're doing their MBBS or they're doing their MD. Secondly, the remote part of it, like uh, right now, there's hardly any technology where you can do operations remotely. A doctor has to be present, but with the usage of this AR, VR, simulated technologies, the doctor can perform complicated surgery from one part of the world. So if the doctor is busy in one place, and a patient needs emergency need to be carried out a heart surgery or any part of surgery, and he's in US. So using this technology, you can perform that operations. Uh, so these are still need a lot of policies, government supports, of course, adaptation by doctors also, and you need to train them young when they are doing their courses, MBBS courses and MD courses. And even for healthcare professional, right, like pharma professional, like how to use medicine, how to use inhalers and all, how to wear medical support devices, right?
Mm.
So some of them might need to be showcased to patients.
Right.
So all that can be done. Like for example, a pharma representative want to showcase it to doctor as a demo. So all that can be done through this technology, and there are great innovations which are happening. If you get time, just go through IC Simulation, their YouTube channel. You can see kind of technology they are creating, and it's wonderful. To be honest.
Thank you so much, Manveer. I think, yes, Dr. Rajput, sir, you would like to say something.
So
Yes, sir.
what he said, Mr. Marmir, I fully agree with you. I fully agree because that's why I said that NLP, chatbots, and processing the things that how the drug is working, right? Because now today the doctors and the patient, they like to understand, when the patient comes to a doctor, every patient is a Google doctor, right? But the being a Google doctor, you should know that where it is going to work. So with the uses of the virtual reality, you can tell that
Yeah.
where the cause is, where the diagnosis of the drug is, how drug is affecting. Like suppose today there are the cancer which can be treated up to the 3 stages, especially in the colon carcinoma or the breast carcinoma, with the right medicine. But how it affects, why radiation is important, why chemotherapy is important, how it is going to help us. So the patient may be more confined as compared to the traditional therapy of giving the platins. We can go for the nanotherapy, which is very important because patient is able to give that money which patient is really hesitating. So in that way we can change the entire thing. See, simulation
Yeah.
is another one thing which is coming up, right? Which Mr. Manvir will really agree. Simulation is a real thing, and today we are talking here. But when we go and meet the 10th class student, they are talking about the robotics, they are talking about the
Yes.
simulation, they are understanding the science, which is very important. So I
Yes.
am not talking about the today's pharma marketeer. I'm talking about the 5 years time. When these guys will come, they will be much far ahead. So we have to start adopting.
Yes.
And today, believe you me, last year I was with Randy Zuckerberg, who is the sister of Mark Zuckerberg, right? They are
Mother,
working a
CEO
lot
of
on Meta, yeah, CEO on Meta. They are doing lot of work on metaverse. Believe you me,
yeah,
into by 2025 they are going to come in such a diagnostic things which is going to change the entire scenario. Today Google is taking over all the data. Today Amazon has jumped. And all these people, they have jumped about it. Why? Because they are able to see a bigger scope, bigger canvas is there in front of that. So we have to upgrade ourselves, which is very, very important. And what he said, Mr. Singh said, I fully agree. It is going to see, digital sampling is going to be a part and parcel of the life. Data driven engagement is going to be a part of the life.
Yes.
Digital detailing is already there. Virtual medical education. You talk so many things which is there. Only the thing is the content and the context at the right place is the real need of the hour. The right content, the right context, which has to be taken care, which has to be in a total way. This is from my side, which I love to add here.
Thank you so much, Dr. Rajput sir. I think Manas, before you speak, I would like to put one more addition question to it. What Dr. Rajput sir finished with, in terms of content part of it, the content creation and adaptation are very important in any kind of platform. You talk about traditional part of it, you talk about digital part of it. When it comes to marketing point of view or communication point of view. So, how to understand and ensure relevant content is delivered to HCPs? Because you have been touched to almost all pharmaceutical company. You know how pharmaceutical company tradition works upon. So, what is your point of view on the content and adoption section, Manas?
Okay.
Can you hear me?
Yeah. I'll put the things in two categories first. मुझे लगता है अपने देश में द प्रेशर इज माउंटिंग ऑन द सेल्स पीपल पोस्ट कोविड ये डिजिटल नो द लॉट ऑफ नॉइज ऑन डिजिटल and I am a very pro sales person. Start with sales, then probably I'll move to marketing in terms of digitalization. Just to remind everybody, when in 2000, if I remember correctly, जब कंप्यूटर बैंक्स में आया, बहुत सारे ऐसे लोग थे जिनको कंप्यूटर यूज करना नहीं आता था. कोविड में एग्जैक्ट द सेम COVID may exactly same situation happened. So first, I would like to tell only one thing before getting into the sale. Sir ने बोला, the PK Rajput sir told, skill sets is the biggest scarcity in pharma sales. Second is you have to enable with training. Just imagine there is a salesperson. The biggest problem in sales is very few people with science, life science background is coming to sales. I'm a pharmacist. I know that for a fact that very less people from the pharma background into sales. That is the biggest problem. Second, you just Google it out. UNICEF in September 2019 lauded in India 50% of new generation people, new generation students, professionals are going to be jobless due to skill sets. The countdown starts there. आई एम अ सेल्स पर्सन, मैं किसी भी कंपनी में काम कर रहा हूं. ऑल ऑफ सडन समथिंग कम डिजिटल. Before we talk about adoption from the doctor side, just imagine the psychology of the sales guy who never got into, उसको पता ही नहीं था कि जूम करके कुछ माइक्रोसॉफ्ट करके कुछ होता है. All of a sudden we just pumped in with everything into a place. That is number one. Number two, we need more training to enable the skill sets of our sales people. I am a very pro sales person. Personally believe, it is my personal opinion based on the interface I made with the doctors, it is very clear how much digitalization you do today in India. At least next 5 years you have to do the promotions with a human touch. So मेरा जो सेल्स रिप्रेजेंटेटिव है, मैं हमारा जो मेडिकल रिप्रेजेंटेटिव है, हमारा जो साइंटिफिक ऑफिसर है, उसको अगर करूंगा, जो रियल टाइम में मैं आईपैड, जो सर ने बोला आईपैड स्किपिंग करना इज नॉट द ऑब्जेक्टिव. आईपैड दे के डिजिटल प्रमोशन इज नॉट द ऑब्जेक्टिव. The content inside iPad, am I, as a medical representative, am I able to tell the doctor that this is the study, this is the mode of action of the drug? So there are two parts of it. One, promotion by the sales executive is necessary with a human touch. We know for a fact that in India, I'm not talking going to talk about other part of the world, हमारे देश में डॉक्टर्स के पास जब मेडिकल रिप्रेजेंटेटिव हमारा जाता है उसकी रिलेशन एक ही दो चीज की बेसिस one is with the technical knowledge, second is the relationship that he build up with the technical knowledge with the regular visits. Number two, we are talking about virtual digital promotion. Before COVID, we used to give the case study journal reprints everything on prints. Dynamics happen
Correct.
in the digital promotions per se. And Udit sir, you are coming from Zydus, you know that Tattva Care is one something that being created and
Yeah.
multiple companies are around. Siplamed, Tattva Care, knowledge genie of Upward. So knowledge is getting concentrated in terms of promotion. So that is number two. Number three is, let's talk about digital promotion. We are all over the places. We are all over the places as a company. We need to define, segmentize the promotions in different ways. I see that promotions today is centralized or segmentized by the pharma company. We started a year before. What's for doctor? What's for SCP? That is the
Absolutely.
part one.
Absolutely.
What's for? I'm talking about patient awareness. I'm talking about patient knowledge. As you rightly mentioned, Manvir sir ने बोला, Rajput sir ने बोला, गूगल डॉक्टर है लेकिन who is going to bring the confined precise to the patient? So what is for the patients? What is for the patients? I was as an analyst, I was looking at one company called Novo Nordics. If you go to social media page, you'll surprised to see the type of awareness they're trying to drive through social medias, be it Twitter, be it Facebook, be it any space. I mean, to YouTube, you talk Insta, everywhere. They are all over the places. So they have rightly targeted. सोशल मीडिया में पेशेंट सबसे ज्यादा रहता है, मैं उधर अवेयरनेस क्रिएट करूंगा, इंस्टा में ज्यादा अवेयरनेस क्रिएट करूंगा, प्रोफेशनल में देखूंगा तो मैं लिंक्डइन पे जाऊंगा, उधर करूंगा, कंटेंट देखने चाहे प्रोफेशनल है या पेशेंट हो यूट्यूब में आएगा ही आएगा. तो मैंने तो पकड़ लिया है. बट आई सेगमेंटाइज माय प्रमोशन व्हाट्स फॉर द डॉक्टर्स. मैं सोशल मीडिया के ऊपर आके वेबिनार्स नॉलेज नहीं दे सकता. सो आई हैव सेगमेंटाइज के डॉक्टर के साथ नॉलेज बांटूंगा. चैनल पार्टनर्स, द बिगेस्ट गेम चेंजर इज गोइंग टू बी द चैनल पार्टनर्स. As I started with the Accent Entero, Accent has created a platform called Retail.io for retail promotion. Oh, abhi additional, they have started charging additional from the pharma companies to promote the products which is me too and movable in the market. कि इसमें इतना स्कीम है आप उठा लो. That is second part. Third, going to play a vital role is the support staff, paramedics. डायबिटीज आज ए डिजीज और एनी क्रोनिक डिजीज, अभी किसी को इंसुलिन लेना है, चाहे वो फार्मा कंपनी कितनी एफर्ट लगाता है इंसुलिन की, जैसे सर ने बोला कि पहले इनहेलर आता था. इफ दैट ट्रेनिंग इज गोइंग टू बी impacted to the support staff through the digital platform, it is going to be phenomenal change. लास्ट एक कंपनी आया 2 साल पहले which is called Docare. Targeted promotions by picking up the content from multiple sites. एससीपी को कहां लेके जाते हैं? डॉकप्लेक्सस पे. हम एससीपी कहां हमारा है? हमारा क्यूरोफाई में. एससीपी हमारा ई मेडिनेक्सस पे है. तो इन्होंने बोला कि मैं यहां से तो कंटेंट पिक करूंगा, मैं एसोसिएशन के साथ कोलैबोरेट करूंगा, जर्नल के साथ कोलैबोरेट करूंगा, सो दैट आई ब्रिंग नॉलेज जहां पे मेरे डॉक्टर बैठे हैं वहां पे मैं ला के दूंगा. सो डिजिटाइजेशन, अमलगमेशन बिग टाइम. लेकिन मेरी टू पार्ट ऑफ इट, सेल्स को क्या चाहिए और मार्केटिंग को क्या चाहिए. आई सॉ फ्यू मार्केटिंग साइड. पहला एंड द फॉरमोस्ट थिंग, मैं अपनी सेल्स पर्सन को digitally enable करूं और knowledge transform करूं, so that when he is inside the clinic, he talks not only the knowledge, he talks through iPad digital version. कि सर आपको कौन सी स्टडी चाहिए? आई एम लुकिंग एट अमेरिकन डायबिटिक एसोसिएशन का ये स्टडी है। सर एक काम करता हूं मैं, गिव मी अ सेकंड, आई एम गोइंग टू गेट इनटू दिस। सर यहाँ पे आपको मिल जाएगा। और व्हाट आई डू, आई आस्क माय मेडिकल, आज माय पीएमटी टू सेंड इट अक्रॉस, बट एग्जैक्टली आपको क्या चाहिए। दैट नॉलेज, गैप इज स्टिल देयर इन द मार्केट। आई पर्सनली बिलीव, आई हैव इंटरफेस्ड विथ मोर देन 2000 मेडिकल रिप्रेजेंटेटिव लास्ट 2 years इन द फील्ड। गैप दिखता है। सो खाली डिजिटल डिजिटल करने से नहीं होगा, थोड़ा हमारी टीम को भी एनेबल करना पड़ेगा। लास्ट, क्लिनिशियंस की बात करें, क्लिनिशियंस आर बोmbarded विथ मल्टीपल डिजिटल थिंग्स। एक डॉक्टर के पास अगर हम जाते हैं, कोई भी स्पेशलिटी ले लीजिए, सबसे ज्यादा परेशान है जनरल प्रैक्टिशनर एंड फिजिशियंस, कंसल्टिंग फिजिशियंस। मैं एक्स कंपनी से गया, बोलते सर मेरा ना ये आईपैड का ये ऐप है, डाउनलोड कर लो। आई वाज विजिटिंग सम डॉक्टर, ही टोल्ड मानस आई हैव डाउनलोडेड 52 ऐप्स। और उधर वो, मैंने उसको बोला कि 1 बजे मेरे को कॉल करना, वो 1 बजे वहां से पिंग करना चालू करता है। मैं यार पेशेंट के साथ बैठा हुआ हूँ, इफ आई एम नॉट टेकिंग द कॉल, सो समथिंग हैज टू for all pharma companies, where SCPs should be given a space in terms of why how to promote the product in फिजिकल और डिजिटल। जो सबसे बड़ी चेंज हुआ है कोविड के बाद, पहले हम लोग का जब हम P1 P2 क्रिएट करते थे, फार्मा में स्ट्रेटेजी बनाते थे, 4 विजिट 3 विजिट ऐसे सब रहता था। नाउ आई थिंक दैट 4 विजिट एंड 3 विजिट कॉन्सेप्ट हैज गॉन। दैट मींस doctors have clearly lauded, you got 2 slots. Now in that 2 slots, you have to say whatever you want to say. You have to talk about, trials, you have to talk about everything, कि मेरा पेशेंट के लिए ये ऐप आ गया है। ऐप के बारे में बात करें, मोबाइल ऐप, every company wanted to launch a new app for the area. Now doctors are choosy, and as Manvir sir told, it is going to be personalized. It is not going to यूनिवर्सल एक ऐप बना दिया, दे दिया। पेशेंट अपना डाटा डालेगा, मैं डायबिटीज के बारे में बात करूं, पेशेंट अपना डाटा डालेगा, मेरी HbA1c इतना है, तो मेरे को क्या करना चाहिए, मेरी डाइट प्लान कैसा होना चाहिए। इट कैन बी यूनिवर्सल। सो डिजिटल स्पेस एज ए मार्केटियर, वी हैव टू बी वेरी वेरी टोल्ड कि दैट डिजिटल हैज टेकन अ बैक सीट। हाउ कम? Digital has not taken a back seat. Digital transformation is going in a different way. As a company, we need to see what adoption we are going to do. Last, जो सर ने चालू किया था, let's divide the country into 3 parts. आज भी हमारा रूरल 70%, अगर मैं पॉपुलेशन देखता हूँ 65-70%, रूरल में हम जा ही नहीं रहे। आज ए फार्मा कंपनी, we have never gone into rural. I have seen companies, I'll not name the companies, I have seen multinational, I have seen Indian companies collaborated with a local company for the rural promotion. अब rural में हम जा नहीं रहे हैं, how do we expect the doctor sitting in rural will be a tech savvy doctor? There is no knowledge transfer from our side. Right. Then come to tier 1, tier and metro, tier and metros. हमें लगता है हम मेट्रो में बैठे हुए हैं, मेट्रो है ना, सब लोग पूरा बहुत बढ़िया अडॉप्शन में है। Just to confine one thing, I was doing a study, market research study, is one of world's NGO group, I'm not able to name it. You'll know in metro there is something called क्या बोलते हैं, हमारे धारावी जैसे जगह है जहां पे स्लम्स, मेट्रो स्लम्स अर्बन बोलते हैं। उधर भी डॉक्टर ऐसे बैठे हुए हैं जिनके पास हम नहीं पहुंचते, जिनकी पेशेंट बेस भी बहुत जबरदस्त। सो यू हैव एज ए सेल्स पर्सन, ट्रेनिंग स्किल सेट्स इज मोस्ट इंपॉर्टेंट as the digital one. Now see, OTC promotion has gone into a different dynamics. We never thought that आज OTC प्रोडक्ट, अगर मेरे पास कोई भी ब्रांड OTC का है, पहले मेरे पास रहता था मैं टीवी पे एडवर्टाइजमेंट दूं। That concept is actually going to take a back. अभी सोशल मीडिया में किधर हूँ मैं, अभी मैं किधर हूँ, डिफरेंट लैंग्वेजेस में हूं कि नहीं हूं, एंड उसकी बियॉन्ड क्या मैं लोकल वेब चैनल्स में हूं, क्या प्रमोशंस में ओटीसी प्रोडक्ट स्टार्टिंग फ्रॉम अमेजोन टू फ्लिपकार्ट टू पेटीएम मॉल, क्या जियो हेल्थ, क्या मैं नेट से प्लेटफॉर्म में पूरी तरह अवेलेबल हूं. What's happening with pharma? Pharma is not trying to collaborate. Very less pharma collaborate with online pharmacies due to one fact
I
that they
think
demand higher margins. They put that responsibility on distributors. तू जाके उसके साथ collaborate कर. But count,
correct.
count works based on my analysis. 2023 is going to be a year of collaboration. Pharma has to shake hands with multiple channels to make it happen.
Hmm.
This is also digital. This is from my side. Thank you.
Thank you so much, Manas. I think,
Excellent.
uh,
Uditji,
yes,
just
Rajput
last
sir.
point. I
Yes,
really
sir.
endorse what Manas ji has said. I like to give you a small details because there was a from brain.com, that was a bain.com, sorry, I remember. The usage of
Been.
the channel from the WhatsApp is 71%. Content of the publication and the clinical studies is 29 to 26%, and the format videos, which is 55%. So that is the way people are using it. And today it is becoming a patient centric approach instead of a doctor centric approach. I'd like to give one of the example here. Sensodyne toothpaste, right? What it shows about it, the patient is love to have ice cream, but due to the sensitization, patient is not taking ice cream. So Sensodyne is
Correct.
giving a relief to three. Once it ensuring the patient's sensitiveness should go down, patient should enjoy the ice cream. At the same time, doctor is providing the right product, and at the same time, Sensodyne is promoting the brand itself. So this is the way the change is happening. Somebody has asked the question that how to put the things. So taking the clue from Mr. Manas, that you cannot give the same tailor-made thing to everybody. You have to change the thing which is required. And since we talk about the AI part, right? Artificial intelligence, it can tell us which area, what type of doctors, what are the contents are there, what has to be promoted. Then we can change the, we can have the change by the brand managers. They can choose the things and they can put the things. Today, somebody is putting on the QR code, somebody is putting about the new thing which is there. It has to be there. And don't do so many things, please. Do only two, three things. That is important. But do the things, right things at the right time, at the right place. Consistency is the key to success, to get the success in the
Yeah.
digitalization world, digitalization way of marketing.
Absolutely, Dr. Rajput sir. I think your last 30 seconds words is actually summarizing the overall context of the story. I think we are running short of time, so we'll take questions because it is the question hour section is flooded with a lot of questions which are like related to them from the point of industry also. So let me take the first question from Uttam. He is asking how can a brand manager can actually benefit from machine learning when planning for any doctor marketing activities. So I think Manvi, you want to put this, the
Yeah, sure,
answer?
sure. So I think in order to actually initiate machine learning to plan the marketing, uh, I think whatever your marketing channel is, like if you are using Lead Square, which is a lead management software, right? So that needs to be closely integrated with machine learning. Uh, so I think most of the channels is your CRM channels or your automation channels, right? Like the marketing automation channels like HubSpot or your Salesforce of the world, that needs to be very well, merge align with the machine learning and NLP. So what data it gives you is like, how many doctors open up your email or open up your WhatsApp. Like for example, WhatsApp open rate is 99%. So if you have sent a message to 100 doctors, 99 will actually open and read your message. So you need some, machine learning will actually give you those insight at which platforms are working very well for you, where your message is been read, what is the open rate, what is the conversion rate. If you have any call to action in your email marketing campaigns, for that matter, your notification, your web notification or app notification, which you have created specific dot for doctors. So how many of them have actually opened that? And what is the time during the day when they open it? So all that, data set points will be, only available to you if you have integrated those machine learning and NLP engine within the ecosystem which you have created for doctors. Uh, so I think those data point is something which that machine learning will give you, and based on that, you can actually trigger the message when you are more, or when you will be able to receive more success rate of doctors opening your communication or content material which you have shared with them.
Thanks, Madhvi. I think Manas, yeah. So after Manas, we will take the
Yeah,
last
sorry to
summarizing point.
interrupt.
Yeah,
Only
Manas.
one thing. Thing. The best part of our pharma company is we are rich in data. अपनी पास
Correct.
30 साल 50 हेडक्वार्टर वाइज ब्रांड वाइज एक्स वाई जेड डाटा है. हमने कभी उसको देखा ही नहीं. देखा ही नहीं है. We are coming up with a new division currently which is going to work on this. Look at the banking. जो मनवीर सर ने बोला,
Hmm.
पहले मैं अपने पास जो डाटा है, मैंने पूछा ये क्वेश्चन, ब्रांड मैनेजर मशीन लर्निंग कैसे करेंगे, एआई इंटीग्रेट कैसे करेंगे. जस्ट टू गिव एग्जांपल, मेरा दिल्ली हेडक्वार्टर 20% डीप गया है कि मेरी सर का, मेरी जीएम का या मेरी एसबीओ हेड का, कि बेटा ये 6 साल में पहली बार 20% नीचे गया. बट डिड आई मेड ए एनालिटिक्स थ्रू इधर जनरल एनालिटिक्स और एआई. 20 साल का ट्रेंड क्या है, वो हेडक्वार्टर खाली है, कितने दिन से खाली है, क्या है. सो डाटा रिच है फार्मा. उसको एआई में, मशीन लर्निंग में, एनालिटिक्स में डालेंगे ना, इतनी डाटा निकलेगा जितनी पेशेंट डाटा है दुनिया में किसी के पास नहीं है.
Correct.
So, as a brand manager, you need to see what data sets we have internally, then compile with external data like IQVIA, like AWACS, like SMRC, जो prescription का data देते हैं. Then combine it. That is the gray area. This is from my side.
Uh, the session is such like that if we keep continuing the whole day will not be enough, because the amount of knowledge all three panelists is having is enormous, and everyone can learn, imbibe, use it every second of talk what these guys are saying, giving to us. But I think we are half past the timelines. In a nutshell, the most of the queries which have been given by the viewers is almost been taken care of during the discussion. So what we want to do is now to have your final touch points from all three of you. Exactly what is your belief in terms of the growth, the growth mindset of the pharmaceutical market or healthcare sector, and how come the current budget which is coming will support us. So we request all three of you to put down your thought on that. Dr. P.K. Rajput sir, I would like to initiate from your side first.
Sure. Love to have. So the union budget, it is going to fuel the innovation and the R&D. This is point number one, right? Because I remember that talk of the IPA Secretary General Sudarshan Saab. He said about it that currently around we are USD $50 billion we are in size, and we are aspiring to grow 130 billion US dollar by 2030. So this is the point number one. The government should be taking the measures to promote innovations and the R&D, which is very important because we are talking about the biosimilars, we are talking about the nanotechnology. This is point number one. Second point I like to add it here. The budget should also outline the supportive policies because simplifying the GST norms, which is important. And there should be an allocation of the funds toward the Nutra industry. Today we are talking about the Nutra industry, but the Nutra industry is coming in a bigger way. So if we start putting on that, it is going to give an added value to the patient as well as to the consumer. The customs duty exemptions is again very important because it is going to help on the tax part. Production related incentive system has to be given to the new startups, that yes, we are able to produce the thing because we have to combat with China. So we should have this incentive which is going to have. Ease of doing business is very important. There should not be lot many things. We understand today MSMEs are coming up, they are helping, only few things are required. But how to focus on this, how to simplifying the process, it is going to help us. And government should give the support to the innovation fully, totally. It may not happen that everybody is going to become successful, but if out of 10, if the 7 are going to become successful, I think we are going to combat, and the vision and the mission and the dream of our respected Prime Minister will be achieved, and we will be again, will be the crowning glory I likely to have here.
Absolutely. 360-degree change, what is expected from the government point of view also, because ultimately they have to support us if they want to see that pharmaceutical industry, which is very much well established in Indian point from the export point of view also, there should be some kind of support and the kind of channelization to make sure that we grow like anything. Manas, over to you. What is your last summarizing point?
I'll not comment anything on budget. What I expect government to do, like Rajput sir told, they should release funds for innovation. Now, innovation are two parts. One is technological innovation, and second is R&D innovation. Sir has already spoken about it. मैं जहाँ से चालू किया था discussion, where whatever the point I have started the discussion, I am coming back again to that discussion by saying that from the pharmacy of the world, we should aspire, we are heading actually towards life science and health technology of the world.
Technological.
Silicon Valley is going to be India. Going forward over next 2 years, you will see that. Yesterday, I saw one advertisement from Telangana that 1,000 crore investment is happening from Microsoft. That is number one.
Yes.
Number two,
Yes.
coming back, red, red, revolution, evolution, digitalization, startups and consolidation. This is the five mantra the COVID has given to us. Yesterday, I saw one advertisement of Cipla looking at medical device,
Yes.
point of care, जिसमें 20 टाइप का 30 टाइप का टेस्ट हो रहा है. That is what people are. Zydus ne bhi during COVID time, sir, I remember you have launched multiple devices products. Consolidation. Now,
Correct.
consolidation does not mean that I'll acquire a brand. I need to see that how I am going to channelize internally as a pharma company also. एंड विद इन दैट डाटा हम लोग बात कर रहे हैं, मेटावर्स की बात कर रहे हैं. मेटावर्स अभी थोड़ा मुझे लगता है फार्म हेल्थ केयर में बहुत जल्दी आने वाला है. मेटावर्स आज इंटीग्रेटेड बिग टाइम इनटू स्पोर्ट्स. आईपीएल में आप लोग देखिएगा द रियल इंटीग्रेशन ऑफ मेटावर्स. टेबल टेनिस में हो गया, बैडमिंटन में हो गया, सब में हो गया है. आईपीएल getting into, I know one of my friend has collaborated with IPL. Healthcare के अंदर these are the things I think. Digital के लिए I think we are all over the places. As I told you, डॉक्टर के लिए क्या है, पेशेंट के लिए क्या है, चैनल के लिए क्या है, और पैरामेडिक्स के लिए क्या है, उसको अगर मैं सही तरीके से चैनलाइज करता हूं, आई थिंक वी बैंग ऑन अचीविंग आवर टारगेट्स हमारा कंपनी, बिकॉज बॉटम लाइन इज अचीविंग द सेल्स टारगेट. लास्ट सबसे बहुत इंपॉर्टेंट बात, व्हिच इज इंपॉर्टेंट पार्ट, lot of compliance is happening on looking into the market. ये नहीं करना है, there is no clarity around it. So I expect that Indian pharma companies, multinationals, are abiding by the rule of that compliance. I expect, and there is already a trend in the market that Indian pharma companies have already started aligning themselves to follow the compliance. This is
Thanks, Manas. I think fantastically summarized the overall crux of it. Over to you, Manvi. What's
Yeah, I
your
think
wisdom?
the pointers are fairly summarized by Dr. Rajput and Manas. Uh, I will just add one point, right? So, what I think in the budget, right, that the health budget which is going to come up, I think technology will take a center stage. So, by what do I mean by technology will take a center stage is that all the mission or the programs which will be launched by government for the benefit of the industry itself, I think those will be enabled by technology and those will be digital first missions or program is what I'm expecting, from the budget. And going forward, I think that will be the case with all the schemes which the government will launch, especially in the healthcare industry, because that help them to actually scale up at large, especially for a market like India.
Thank you so much, Manveer. I think uh, the kind of expertise and the kind of background which have been covered here is phenomenal, and everyone from the viewer's point of view has taken a best of out of it, because such kind of wisdoms and the learnings should not is not available very regularly. So we should thank Gapsule to create such an important platform and to have such important subject matter experts with us today. And I'm really happy that such kind of conversation should keep going on. to engrace, to give a lot of learnings to all the marketers, all the pharma people who would like to know about what's happening in the world, what are the key things, and how they can motivate themselves for new innovations, new expansions on their horizons. So it's very important to continue to growth in any of the way, increase your capability. That's very important to us. And thank you so much, guys, and thank you so much for joining all the eminent panelists for today's discussion. I think we can overshoot that. uh, Thank you so much, everyone. Thank you so much for watching. Bye bye, take care.
And
Yeah,
Saguja ji, you are awesome.
thank you, sir. Thank you so much for your talk. Thank you so much.
Thank you,
Thank you.
everyone.
Thank you.
Yeah. Yeah, so Has, you can cut it down.